And thank you for joining us. I'm Monique Minglaben.
I'm Steve Rabel. Again, as you just heard, Governor Inslee said he is not mandating to shelter in place, but that could still happen if people don't start staying at home. Here are some of the other major headlines in the coronavirus case. The White House says a member of Vice President Mike Pence's staff tested positive for coronavirus. The staff member did not have close contact to either the vice president or President Trump. Washington reported 8 new coronavirus deaths, bringing the total to 83. There are now 1,500 cases in Washington and more than 15,000 nationwide. And Boeing CEO Dave Calhoun and board chairman Larry Kellner said they will forego all pay until the end of the year. But the company didn't say anything about shutting down operations.
But top of mind for everyone are our hospitals prepared for more cases in this pandemic. Team coverage begins with Cairo 7's Allison Grandi. And Allison, medical leaders are pleading to get the Navy hospital ship Mercy sent here.
They are, Monique. While hospitals are dealing with many patients with coronavirus, they're slammed. Plans are underway for when there are too many sick patients and not enough ventilators. And tonight, doctors tell us having the U.S. Navy ship Mercy docked here in Seattle could delay some life and death decisions.
I want to be really clear. This should not happen. This should not happen in America. It's immoral.
As the number of coronavirus cases overwhelms local hospitals, doctors and nurses are going to have to make critical choices about who gets care.
If you had more patients who needed care than you had ventilators, you would look at the whole group of patients and determine who has the best chance of survival, and that's who gets the ventilators. And then the patients who don't get one with this disease are almost certain to die.
Instead of individualized care, it becomes crisis standard of care. The region would move around patients between hospitals, and when capacity is reached, they go into crisis standard together.
And our medical system will be the first one that is stressed.
Governor Jay Inslee asked the feds for the U.S. Navy hospital ship Mercy to be docked in Seattle. It has 1,000 beds, 12 operating rooms, and CT scanners.
It would be the place that non-COVID patients would go. So like potentially a heart attack patient would go there. If the hospitals in Seattle were swamped with COVID, someone had a heart attack, they would go there.
While pop-up hospitals like this one set up on a shoreline soccer field will help with capacity, they don't come with staff and supplies. The hospital ship arrives fully equipped. To know hospitals are on track to reach crisis standard if the feds don't send more equipment and supplies is hard for Cassie Sauer to comprehend.
It's been tied to the notion of an earthquake, that you would have potentially, 5,000 people who need care in the space of an hour. How do you determine what happens in that case? It is not acceptable for this to happen in something that's evolving. It's not evolving slow. I mean, this is a relatively rapidly evolving situation, but we see it coming. An earthquake we don't see coming.
She also said it's not too late. She said the feds can access the stockpile, including ventilators, and sending the U.S. Navy ship here she thinks would make an incredible help. But it's not just Governor Jay Inslee fighting for it, so is the governor of California. We have more on that tonight at 6 o'clock. Live in Seattle, Allison Grandi, Cairo 7 News.
Well.